Discoloration of the ankles or what causes eczema? Symptoms and latest treatment of 8 types. What causes eczema? Is dermatitis and eczema is same? Before this, we will study what is eczema. A medical condition in which patches of skin become rough and inflamed, which cause itching and bleeding and occasionally cause blisters. Generally, both these terms are used interchangeable, so in short, yes, eczema and dermatitis are same, and it means inflammation of skin due to various allergens, and on that basis there are broadly 8 types of eczema as discussed below. Different types of eczema. Dermatitis. Exogenous eczema. 1. Contact irritant dermatitis. Due to exposure to detergents and vegetables, seen in housewife, that's why called as housewife's eczema. May occur on first exposure. Cells are not formed. 2. Contact allergic dermatitis. Due to exposure to allergens like nickel found in ornaments, potassium dichromate in cement, theorem in rubber, cobalt chloride in tattoo dye. Does not occur on first exposure. Memory T cells are formed. Diagnosis is done by patch test. A small quantity is placed in film chambers and small quantity of the allergen is placed over the back of the patient. If patient comes positive for allergen, it confirms the diagnosis. 2 readings are taken on day 2, 48 hours, and day 4, 96 hours, respectively, to confirm the diagnosis. 3. Airborne contact dermatitis. Congress grass causative allergen, sequester pine lactone, also known as Parthenium histriporus. It occurs by the air carrying the pollen, and therefore this dermatitis mostly affects the exposed areas of the body like face, hand, feet. Seen in farmers and gardeners. Patch test is positive for sequester pine lactone. Patch test for dermatitis. Endogenous eczema. 1. Nummular discoid eczema. A stubborn, itchy rash that forms point-shaped patches on the skin. Nummular means point in Latin. The lesions as they get older may clear in the center of and resemble fungus, ringworm, or psoriasis. 2. Stasis dermatitis. Due to pooling of blood. Gravitational eczema. Skin inflammation in the lower legs caused by fluid buildup. Stasis dermatitis is caused by fluid buildup due to varicose veins, circulation issues, or heart disease. Skin discoloration of the ankles or shins, itching, thickened skin, and open sores, ulcers are symptoms. Treatments may include compression stockings and prescription creams, as well as treating the underlying condition. 3. Cradle cap seborrheic dermatitis. Seen on the scalp of infants, it can also occur on oily areas of the body, such as the face, upper chest, and back. In addition to scaly patches and red skin, seborrheic dermatitis can cause stubborn dandruff. Self-care and medicated shampoos, creams, and lotions. Repeated treatments may be necessary. 4. Estertonic eczema. Winter eczema. Eczema craquelé. Due to cold and lipid deficiency, occurs when the skin becomes abnormally dry, itchy, and cracked. It is often found in elderly people, though it is not uncommon for people. 5. Atopic dermatitis. Skin rash, which is common in child, can also occur in adult. Atopic meaning allergy, derma meaning skin, and itis inflammation. Atopic dermatitis is defined as a skin inflammation in response to allergy. More specifically, it occurs as a result of the inappropriate attack by our immune system on the skin, targeting the flexor surfaces like side of elbow, creases of wrists, back of knee, and exposed skin surface. Increased transdermal water loss. Different sites showing atopic dermatitis. What causes eczema? Pathophysiology. When immune system attacks inappropriately at itself, it is known as hypersensitivity. There are 4 types of hypersensitivity reaction. Atopic dermatitis is a type 4 hypersensitivity reaction. Starts off with something in the environment, allergen like flower pollen. The pollen travels to the slightly pore skin where it is picked up by immune cell known as antigen presenting cells, since it present the antigen that is pollen to the naive T cells, which is converted into Th2 cell. This Th2 cell activates nearby B cell to produce IgE or immunoglobulin E antibodies specific to that pollen allergen. These IgE antibodies binds to the surface of called mast cells, basophils, which are found in the tissue layer just below the skin. This process is known as sensitization. Now let's say there is another episode of exposure to pollen, second episode, and it makes its way into the skin tissue. Now the allergen can cross-link the IgE sensitized cells, resulting in and release of pro-inflammatory molecules like histamine, leukotrienes, and proteases. The cumulative effect of these molecules is to dilate the nearby blood vessel and to become leaky, thereby attracting more immune cells in the area, causing inflammation of the skin tissue. Ultimately, this skin barrier more leaky, potentially allowing more of the allergen as well as water to escape, making skin dry and scaly. Dry skin is very itchy and hence person scratches, causing more damage to the skin barrier, and the itching aggravates, leading to vicious itch-scratch-itch cycle. Occasionally bacteria can invade into skin, causing more inflammation. Atopic dermatitis can worsen in the presence of allergens like cigarette smoke, mold, and dust mites with change in weather, with stress. Usually causes a patch of red itchy skin that come and go. Skin may occasionally blister and peel. Over time, the skin can become like an inflamed, leather-like. Itchiness is often worse at night, probably because there is no distraction. This is when children scratch their eczema lesions. Since it's an autoimmune condition, it can't be spread to other people. But since it affects the skin and affects appearance, there's a lot of social stigma to it. Unfortunately, many of them, especially teenagers, suffers from depression and social anxiety as a result. Genetics play an important role in its pathogenesis. And often individuals with atopic dermatitis also suffers from asthma, allergic, known as atopic triad. These illnesses often run in family. Occasionally it can also be a part of like hyper-IgE syndrome, autosomal dominant AD, form known as Job syndrome, phenylketonuria, metabolic disorder that results from the buildup of phenylalanine. Rutsch syndrome, X-linked recessive disease characterized by clinical triad of eczema, thrombocytopenia. Diagnosis. Mostly clinical. Diagnosis is made by Hanifin and Rajka criteria. Hanifin and Rajka criteria consists of 4 major and 23 minor criteria. Major criteria: 1. Pruritus. 2. Chronic. 3. Family history of atopy. 4. Distribution of lesion, adult flexors, children flexors, and infants flexors, face extensors. Few minor criteria out of 23. 1. Allergic. 2. White demo. 3. P. Alba. 4. Keratoconus. 5. Denny Morgan fold, extra skin fold in lower eyelid. 6. ASSC and subcapsular cataract. 7. Woolen top. Histopathological findings: acute phase spongiosis, losing out lesions; chronic phase acanthosis, lichenified lesions. Treatment: there are ways to break the cycle of allergy-mediated inflammation, dry skin, itching. Identify and avoid triggers. Avoid overheating. Choose a soft fabric for dress material. Manage stress. For dry skin, applying moisturizer after a warm bath before going to bed. Itching is easily managed by keeping your nails short, trying to keep children from scratching. Most of them resolve by following this basic skin regimen, but for several cases following immune suppressants are used. Acute dermatitis, corticosteroid topical plus systemic. Chronic dermatitis, corticosteroid topical, tacrolimus calcineurin inhibitor, systemic azathioprine. Antihistamines, for itching, antibiotics if infection develop. Atopic dermatitis, for mild, moderate atopic dermatitis, crisaborole PDE4 inhibitor. For moderate severe atopic dermatitis, duplolamandil -4/13. Contact dermatitis treatment. For highly edematous, vesicular and exudative eruptions, eliminate allergen, astringent soaked in 1 to 10,000 solution of potassium permanganate, potassium permanganate, Burow's solution, aluminum acetate. Dr. Rabia Akhtar, MBBS Bachelor of Medicine and Bachelor of Surgery, has received her graduation from India. Special interest, surgery, chronic disease, emergency medicine, pediatrics. Disclaimer. Medical blogs are not intended to be used for diagnosis or treatment.